you get all the work done, right? So you go through and you prove to IT, okay, we vetted out the 4 top solutions that are out there. And we've built the pro and con list for all of them, including the pricing, the data points, all of the things. And then working together, you figure out, okay, sign a project manager. Now we're moving. In 2 of the cases, once we got beyond 6 months, another solution had come around that was actually more robust. And the fact that you are staying on top of it allows you to then pivot with your IT team and do that vetting process with them again, just to make sure we aren't turning something on and spending a lot of money that once that you turn it on, like there's no value add for you or the system.
Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civit-Therese, and today I'm joined by Alyssia Cruz, Vice President of Orlando Health's Cancer Institute and Urology Service Line. In this role, she's responsible for developing, leading, and implementing the operational direction for cancer and urology services throughout the Orlando Health System network. Prior to joining Orlando Health, Alyssia held executive positions with the Miami Cancer Institute at Baptist Health, South Florida, and University of Miami Health System's Sylvester Comprehensive Cancer Center. She's an active member in many professional organizations and currently serves on the board of directors for the Association of Cancer Executives and the North Florida Leukemia and Lymphoma Society. Welcome, Alyssia. It's great to have you on the show.
Thank you. Excited to join.
Yeah, and today we're going to be talking about a topic that I think is really interesting, and that's your experience in getting service line projects prioritized with IT. So before we jump in, I'm hoping you can give us a little bit about your journey in healthcare leadership and your current role with Orlando Health.
Yeah, absolutely. So I've been in healthcare operations now for almost 25 years. Just landed in Boston for a weekend, was working in sports and couldn't find a paying job in sports and landed at the Brigham and Women's Hospital. And as a result of having really great physician mentors and colleagues, found that I loved it and stayed. I've worked in pretty much every specialty from primary care to every subspecialty. Really love startups and creation of new clinics, new programs, new ideas. And about 4.5 years ago, landed at Orlando Health as the Assistant Vice President for the Oncology Service Line and recently promoted to Vice President and extended into Urology Service Line as well. And the joy about my role is not only we say the Cancer Institute, but there's so many non-cancer programs that we house. So for me, I get to create with so many different physicians and teams every day for patients and communities. So it's exciting time in healthcare.
Yeah, it's really outstanding. And I can imagine, all the kind of connective tissue that has to happen in your role, getting together, to your point, physicians and IT and all sorts of other, stakeholders that I'm sure we're going to talk about. And I know how challenging it can be in a large health system like Orlando Health to sort of affect those IT project prioritizations. And I know that's one of your areas of expertise and what we'll be talking about. So let's start by diving into why is it such a critical issue in today's healthcare environment in terms of that IT project prioritization?
I mean, when you think about what's going on in healthcare right now, it's the age of technology, innovation, AI, all of the cool tools, right, that everyone is developing nonstop, and how it applies every day in the work lives of physicians, APPs, nurses, the frontline staff. So everything IT is critical in how we function and how we navigate to take care of patients, and even putting technology in the hands of patients, right? So how systems are utilizing communication with patients and even AI generated just reminders of appointments and what's going on. And patients have their preferences. So having your IT systems nimble enough to meet all of those end users is critical. And then in a large system too, I mean, we are on an EMR called Epic. Many systems are on Epic, but many are not. And when you're dealing with the community, you may find that you're playing with partners who have a separate, smaller EMR. So discovering those pathways to be able to communicate, because we are sharing patients, It's another critical factor in how we're able to care for patients along the continuum, regardless of specialty. So whether they're coming in for a primary care visit, landing in the hospital for an ED visit, it's all the same kind of platform of needs, and just getting those records of where they were before. What does that look like along the continuum? So the IT piece is huge. We don't function without it. I remember when I started in healthcare, bringing one of our clinics up from paper charts to the EMR. And now I can't fathom that idea.
Right.
But there are still places in existence that have paper charts. So being able to have IT solutions to kind of bridge those gaps, and make sure that whoever is seeing that patient has everything at their fingertips to see the full picture and care for patients. And I think that's why IT, it's not going anywhere, and there should be more robust teams of IT teams to support the battleship of IT when you think about it.
Yeah, absolutely. And you alluded to this in that statement as well, in terms of just the pace that this thing moves at. And technology innovation is moving incredibly fast, particularly, now in healthcare. And sometimes, I know that projects can take years in some cases to go fully live. The EHRs are obviously a great example of sort of that journey that health systems have been on. I'm curious, when you look at projects and the timeline of projects and how fast innovation moves, how do you ensure that initiatives stay cutting edge, that they don't get stale sort of before they're out there?
Absolutely. And we've been witness to both where it's still relevant and where it's not relevant any longer. It's an art. It's a fine art. You can't just submit the project and then just wait for it to go live.
Right.
Some of our bigger projects are taking up to 18 months to get it fully implemented and, interfacing with Epic, where it's something where we're not going outside of the EMR. I think that's the biggest piece right now is you go to a conference, for example, and you meet 15 really up and coming, very exciting new technology developments and solutions. And early on, when, 10 years ago, I would get impressed and come back and say, okay, we want to go live with this, right? It seems like it solves them to do all these things. And then you start to learn, when the IT team gets involved very early with you, what does that feed look like? How will that interface? What does their team consist of? What does the code look like? Questions you never think of as an end user, or the person trying to let me just pay for it. We want to turn it live. My physician brought me this. So then in the last 4 years, we've had a few projects that by the time you get all the work done, right? So you go through and you prove to IT, okay, we vetted out the 4 top solutions that are out there. And we've built the pro and con list for all of them, including the pricing, the data points, all of the things. And then you really go to committee with them and understand, okay, what does it look like? What does their build side look like?
Right.
And then working together, you figure out, okay, sign a project manager, and now we're moving. In 2 of the cases, once we got beyond 6 months, another solution had come around.
Wow.
That was actually more robust. And the fact that you are staying on top of it allows you to then pivot with your IT team to figure out, okay, no, we thought this was best solved, but this actually is better solved, and do that vetting process with them again, just to make sure we aren't turning something on and spending a lot of money that once that you turn it on, it's in value. Like there's no value add for you or the system. So 2 projects, one in which we did at the very last minute, we're getting ready to go live, talking about what those next steps look like. And we quickly pivoted because our actual EMR provided a solution in the EMR that would do the same things with the same go live time.
Wow.
So quickly pivoted, saved all of that money for the system, got the same results, happy patients, happy team members, happy nurses. And then in the other situation, it slowed us down with implementation, but at the end of the day, it will be a better product. So you just never know, but it requires you to really stay on top of it. We have regular cadence meetings with our IT steering committee, both internally and then outside with the actual IT teams building, just to make sure we're all still in sync, we're all still on the same timeline, and that nothing has changed, because you're attending conferences and getting approached, but so are they. So they also have interfaces with Epic and what's coming from them that we may not know about as an end user. And at the end of the day, there's so many solutions that everybody wants it to be a one-stop shop.
Right.
If I'm in my clinic, I don't want to go to 4 different sites. I don't want to have 4 different screens with 4 different systems. So the goal of making it easy to use is always critical. And that's how you win over your physicians and your APPs, your people who are doing the work in there.
It's really interesting. And what you're describing is it sounds like kind of a balance between kind of keeping long-term system goals in mind and still being adaptable to change where you need to pivot and so on and so forth. I'm curious, what kind of strategies have worked for keeping those IT projects aligned with the long-term goals while still being able to be, adaptable to change where you need to?
Yeah, I mean, it's really staying connected. So I work very closely with like our IT, the internal assigned BRM or business relationship manager. And we're constantly just comparing notes on what's coming out via Epic, via EMR. What are other systems talking about? We're in a couple of different user groups just because of the work we've done with pilots and other things where you hear about, wait, where they're doing this enhancement, or hey, we heard about this new thing. So you have to stay in the pulse. And I think it's on both sides. It has to be IT and the end user. And really just every 3-4 months, we have an overarching with senior leadership on both sides, just relooking at here's the current queue. If we know that because of resources being deployed to other projects, other areas, we tend to acquire a lot of hospitals. That's what we seem to do a lot of. So that will shift some of those lower rated priorities and really then having to have those conversations with the stakeholders who are anticipating that being turned on what does that look like for them? And then how can you help them in the interim? So it's really transparent dialogue and really helping IT. If it's 12 projects in the queue, really helping to focus on this one will serve the greater good, has the largest impact, because at the end of the day, it ends up being that same resource team that's building those 12 projects for you. So really helping them to keep aligned with what's the most important thing for you in this next quarter. So they're allowed to pivot as well.
Yeah, that's great. And I know obviously Orlando Health, as you say, you're a huge system that keeps getting bigger, as the industry continues to consolidate. And I have to imagine the competing IT needs, as you describe, like 12 projects might be a light day. I'm curious how you navigate getting your service lines project prioritized among so many of those others. And if you have some stories or examples, we'd love to hear those too.
Absolutely. I think the last time we really looked at system projects, they were in the thousands, right? When you're talking large projects. And to your point, I think I referenced it earlier. We just acquired a system in Alabama and a system on the East Coast. Yep. Well, immediately you find out when you get in there, well, they're not up on PACS, right? So now your whole team needs to shift over there to make sure we can actually treat patients. And I think everyone understands that. If it's not harming you in your day-to-day, and it's really, truly an enhancement to what you're trying to provide or do, or just saving 17 clicks for a doctor, it helps you set the framework. Because at the end of the day, we all want to take care of patients and provide the best quality care. So I think in those very transparent conversations, it's just being honest with one another. When that happened, I got that call, 8:00 on a Monday. Hey, this is coming and we have to shift. Are you going to be okay? And can you talk to your physician champion to make sure they're okay? And at the end of the day, if it's not something where in that case, there's no solution. So you have to create a solution. Right. Many of our other projects are enhancing or creating a new, like we're turning on paradigm where you go in and you scrub the EMR for clinical trial appropriate patients. Right. Can we still do business as usual without it? Yes. Will we do it better with it? Yes. But in the case where patients can't get their imaging done because no one has a system to read, that takes priority. Right. So I think in them being very transparent and having that review with us ongoing, you're able to sit as a team and say, for system, yes, we're prioritizing together. And then really just bringing those physician stakeholders in, because typically a lot of your physicians are driving some of those new things, right? They've been at a conference or one of their friends has decided to leave medical practice and develop a new solution because they saw a void in what was created everywhere. So you have someone who's very excited and wants to champion, and you're getting into the cutting edge. But again, you're rebalancing your priorities of what can we shift and how can I talk to people to make sure everybody's still excited and they don't feel like they're getting slighted. And so for us, A lot of the times you do have to be the squeaky wheel when it's really important.
Sure.
Great, it's great to grow, but we already had this in the hopper. So I know it will take you another 6 weeks to complete it. And if you put me off for 6 months, we've lost that 6 months or whatever that timeline is when you finally get back to us of a patient population that we didn't even know we needed to serve.
Yeah.
So I think reframing some of those conversations for stuff when we turned on Think, it's a lung incidental and nodule and lung screening kind of platform. If we wouldn't have done it, we wouldn't be identifying patients early with a potential lung cancer that we could get to stage 1 versus a stage 4 ED visit. So I think setting that framework of understanding what you're putting on pause. Sometimes you do have to be the squeaky wheel. Just to say, yeah, it's great to acquire and get them live. But if you're 6 weeks off of completing this, and we can identify 1,000 patients in the community early, what does that do for
Absolutely.
us as a program? And that trust you build in that community.
Yeah, and it's so interesting because, I think sometimes we think about IT through the lens of, exactly that around, technology and so on and so forth. But what you're describing here is a real kind of stakeholder mentality where, people and not just internal stakeholders in terms of, the physicians and, clinical staff, nurses, so on and so forth that you're serving. But at the end of the day, the patients too, which is obviously, I feel like sometimes it's almost easy to lose track of sort of what the objectives are and where we all sit in healthcare and what our mission is. So I think that's really an astute observation. And the other thing that you talk about is the end users and the importance of involving them and their voices into the equation. How do you make sure that their voices are heard in that decision-making process? And do you do that, to what level of intentionality do you do that with?
I think now, years in, there's a lot of intentional work if I'm involved, if I even hear a whisper of something cooking, because again, we're large. We have over just the Cancer Institute, over 1,000 team members, 106 doctors, right? So imagine 106 doctors over all of Central Florida and the West Coast involved in things. So there are surprises sometimes too, where I'm like, oh, I didn't know we were doing that. But making sure the right people are at the table, because if you haven't sat through the resulting presentation of, hey, we just built this and turned it on, and they go through something and walk you through all the great steps and all the great work, and they show you in the EMR, and then you have people at the table go, yeah, but no, that's not how my workflow goes, and that's not helpful for me, and no, we'll just go back to using this Excel sheet that we've been using for 5 years because it's easy.
Yeah.
And you're sitting there watching that someone has engaged a third-party consultant to build it. So not only have you wasted someone's time, you've paid for resources that have now been put on a shelf because no one's going to use it. And watching, like I watched on my team, they did that in a silo. And I think everyone was then pulled in a room on what lesson did we learn? Because if you don't have the stakeholders there, and I could sit in this office and come up with all kinds of solutions.
Yeah.
But if I don't know down to the boots on the ground person who's doing it every day and assuming I know, I'm not going to have a successful rollout, right? So in any product that involves any of my frontline team, patients, if it's truly just patient facing, when you think of my chart and how we're communicating with patients with their results and appointments, we even created, because we were short on staffing, a pre and post infusion kind of check-in, right? You get it. And then if you're having symptoms, it's kind of a self-diagnosing management tool. And then a phone number if that doesn't work. That was to help because the staffing were so overwhelmed. But if we didn't involve the folks in the infusion center when we turned it on, and all of a sudden they started getting all these calls, it wouldn't have been a success.
That's right.
And sometimes the things that you miss sitting at a leadership table is that day to day when they have really great suggestions and what they're hearing from the patients. So if it's patient facing, we pull in our patient family advisory council and make sure, hey, this is what we're thinking. Can you tell me about your experience? Would this be an enhancement, or what's your feedback? And they will give you raw feedback. And it's the same when you're talking about anything that impacts us, nursing, physicians, etc. Getting them at the front, at the table, and understanding, I don't need you to help me build it. I need to understand what would make your work life simpler.
Right.
And then as we come back with solutions and tweaking, you'll be at that table too. I think once you've been burned once or twice, you know you never want to do another one without those key folks. And not just people who want to sit in a room and talk, but the true people that want to see it changed
Right.
and want to make it better, right? Less clicks, less time in the room away from a patient, less time doing things that are not value add to patient care, and same on the patient side. Less time where I'm getting the same questionnaire 16 times
Right.
because you haven't organized yourself on that end and pulled it into the EMR so you can see it and you can stop asking me, like really listening to what they're saying. It also makes patients in the community feel like we truly are listening to them the first time they share that information with us. Because
Absolutely.
if I repeat myself 5 times in 5 different visits on, yes, I'm allergic to iodine and IVP dye, do I lose a little bit of trust every time I come in? I question it.
Yeah.
If I'm telling you every time, are you accidentally going to give me iodine sometime? I don't know. But I think it might be a little painful sometimes to put all of those stakeholders in a room, but what you get out of it at the end is worth every second.
How does senior leadership play into this? So obviously you've developed a really great cadence in the service lines that you operate. I'm curious, is there like I'll say almost like like some air cover that gets created by the senior leadership team, by the C-suite? Is this something that is, I'll say, kind of unique to the service lines that you operate under, or is this kind of driven in terms of the culture and the cadence and all that good stuff from a senior perspective at Orlando Health?
I can only speak for the service lines I'm involved with, but it seems like in talking to the IT teams, it's something they do replicate for the
Yeah.
same reasons and the same benefits. I think we're probably a little more annoying. There's so many things being developed in the oncology lens. I don't know what that looks like in primary care
Right.
because the science doesn't change as much as oncology, where I'm needing to add a new liquid biopsy lab and resulting and getting those results in quickly. Some of that is just changing as we change the platform of how we treat cancer patients.
Yeah, absolutely. And I mean, cancer care is it's so unique because I mean, there's a recidivism sort of element to it where those patients are coming back kind of over and over again in terms of their treatment plan. In a lot of cases, it's a lot less kind of episodic, I'll say, versus some of the other potential service lines that might be out there.
Absolutely.
And so I'm curious, how does that play into it? I mean, what are some of the unique considerations when you think about, because as you say, you've spent time in almost every single service line that's out there in
Mhm.
these health systems. How does cancer care differ from some of those other service lines?
I think to your point, they're not coming in for like one visit, one and done, or two and done. A lot of the times you're seeing them for the next 6 to 12 to 18 months, and they're having multimodality of treatment. They could have come in for surgery and then radiation or then chemo and then radiation. So you see them over the long haul, and there's so many teams that interact with them along that continuity piece
Yeah.
that the IT piece is critical to even help you manage and not be on top of one another and really make it seamless for the patient. So having a navigator, like an actual nurse navigator, to sit and look at the care plan and be able to help the patient not fall through those cracks, because as you imagine, there's thousands of patients coming in on that same long continuum.
Yeah.
So it's just a little bit different, right? So our goal is always, what is the newest? And it's not always a new software, but what are the
Right.
things that we're just not doing well enough? What's the flow? How can it be tweaked? So even we have a chief medical informatics officer who's also a head and neck surgeon for us. But in the past 3 months, what they've been doing is he brings in the clinical informatics team. They'll go into a clinic and just walk me through your day. Let me see if we're maximizing
Hmm.
what we can do. Let me see your hiccups and your bottlenecks so we can go back and figure out, is there a different way to do things? So it is less onerous on the physician and the team and more value add with them sitting in front of a patient, right? So
Right.
through that work, they've just found that we need to make some tweaks to how they're documenting. We have AI scribes in place at this point. So really teaching people it's okay to have an AI scribe, and let me show you what it can do for you as far as getting your note pretty much all the way done. And then you're editing and some of the smart art kind of responses to patient inquiries coming in, some of that work, being able to implement those things and change their life as a clinician taking care of patients. So less time at night trying to close charts, all of the things, right? All of the great work that we can do. So sometimes it's not about just rolling out a new software, new things, tools on top. It's really honing in on what are we doing well? What are we not doing well? And then how do we retool it? And I think that's been super helpful for many of the teams. And there's a lot of great just ideas coming out of that work.
It's really interesting. You also touched on, I mean, so it sounds like in terms of getting projects off the ground, obviously, and prioritized is one thing, but it doesn't necessarily stop there or even at implementation. It sounds like there's almost kind of like a feedback loop that you want to create to consistently evaluate, what have we done? Is it working? And kind of what's the next step? Is that fair?
Absolutely fair. And I think a lot of the cool new pilots of even things that are coming out from Epic, sometimes they start in primary care, right? Because it's not that they have more time. They just have a different audience of patients where they can easily implement, where we have regimens of care and treatment orders and all the things that aren't easy to just pivot from. So a lot of the work in cancer is kind of tweaking. Do I have to sign off on each one of these chemo regimens separately, or can you get it where I can click 6 of them out of 12, or can I click all 12, right? It's just this ongoing work of enhancement of their job and making it easy. I think our sole job is to make it easy to care for patients as leaders in this role,
Absolutely. And I have to ask this question very selfishly as a healthcare technology vendor and for all my other healthcare technology vendors that might be listening. So to what extent are vendors able to help you through these processes? Or maybe to put it a different way, when you think about the best vendors and suppliers that you've worked with on the IT side, what kind of sets them apart in terms of helping get these things prioritized on that list?
A lot of the great relationships that I've had in the past 4 years, just in rolling out a few different things, it's the vendor being very responsive, being able to quickly go through what does it look like for build? Because a lot of times you hear, HL7, whatever the next one is, and we can have it done in 6 weeks. Just understanding that question of what does your IT team need to see from us so we can make this build easy, right? What are the questions I can answer from them? So folks who are not just trying to sell, but really getting in there and providing, this is what your IT team is going to ask you. Like the last two I've done is, this is what they're going to ask you. So here's the 7 answers, and then pull me in the room with them so we can have, before we even get started on the sales piece, pull in the IT team so we can have those IT to IT questions answered to even see if it's feasible.
Yeah.
So I think that works because a lot of times you get sold a dream. Right. And then when those IT stakeholders weren't there at the table in the very first conversation, you learn that all the promises, well, maybe they've never done it before. Maybe they've never done it with your specific EMR before. Right. Or, whatever that looks like, there is missing factors when you were going live.
Sure.
So I think in setting the sale aside for a second to make sure it's going to be a success. And if you want the sale, you're going to have to do that work up front and really get the right stakeholders.
Yeah.
Because you can tell me whatever, it sounds cool. And then I'm going to take it to IT and they're going to annihilate me on, did you get this, and this, and this? And then being the last two, they check in all the time. They ask how they can tweak and enhance. So it's really going toe to toe to say, we're a partner now.
Right.
Your success is our success. So it's not like one and done, team is there. And now you never see those key people that you started with. I still hear from 2 of them regularly and share, hey, this person just presented at ASCO quality. And maybe you guys should talk and see if there's some synergies in how you roll out your next phases. So constantly thinking of what's that next evolution.
Right.
And I think it speaks to the partnership.
Absolutely. So as you think about your peers and other healthcare leaders, if you were to give some advice to leaders that might be struggling to get their IT projects prioritized, what would you tell somebody? If I were your peer and I came up to you and said, hey, I'm having a real problem here getting my stuff prioritized on the list, what should I do? What do you think you would say to something like that?
I definitely think it's all about the data, right? So in order for me to convince the CFO that this is a good investment, I need to have all of that data crunched in. What is the ROI? What am I serving? Is it something subspecialty niche that we just don't do? Is it something we don't do well? what am I going to impact? If it's just financial, is it quality? Is it outcomes? Being able to have all of that outlined to sell the case, you got to start there. You got to make sure you've done the homework of, if it's just one, they're going to ask you, have you vetted out other companies, right? So making sure you have the Epic scope or your EMR scope, and then the other 3 or 4 or even 2, whatever the competitors are in that lane,
Right.
get the scope, get the full scope that you've done your due diligence. And so when you're showing data of what it's going to bring to your system, you also can say, I've done the homework of, this is the best solution and this is why we should pursue them. So you have a solid case. If you don't have any of those things, you're not going to be taken seriously. So you're going to the bottom of that list, because then they're going to have to figure out how to put that together for you. And when they have 7,000 priorities going, you're going to be bottom of the barrel. So doing all of the homework and understanding from an IT lens, even asking your friends on the IT team,
Right.
what is it that is being discussed in those meetings where none of the end users or administrators are in? How are you weighing priorities? What are the big things you're looking at? Is it biggest bang for the buck? So not only is it impacting oncology, but there's the benefit of turning it on for the system if we do this well, and understanding that. So when you're making your business case, you've already incorporated that. So I also like to do a lot of preliminary, give the IT team a heads up. So my counterpart in IT, she'll be my first call. This is what we're thinking. Have you heard of them? Have you seen any of this demo? How do we want to move forward? So when it does land on their desk, it's not a surprise. Yeah. And then they're in the know, and they can speak to it just as well as you can. So just doing all of your homework up front is critical. They might have 3 or 4 questions that you don't know, but when you have 40 of the 45 already on a platter for them, they know that you're serious.
Sounds like having the data available and knowing your business. It's kind of the old Shark Tank TV show. Do you know your
It
business?
is.
Do you know your numbers? Can you communicate that effectively? It's pretty interesting.
It is. It's the same.
And then it sounds like relationships. I mean, it's amazing, all the technology, all the processes that at the end of the day, there's a lot of relationships here too. Do you have a relationship with the physicians, the nurses, with your counterparts in IT, and being able to, have those connections and build those bridges sounds like it's vital as well.
For sure. And then keeping them. So one thing I've had with some of my physicians that came from the outside, they're used to their other organization, and then you hear them speak of your IT team in a way that you're like, no, let's not do that. Let's not attack them in email. So it's really even coaching your other teams, your key stakeholders. We need these guys for the long term.
Right.
So let's make sure you're winning trends and influencing people the entire route, because being the angry bird doesn't get you very far. It might get a couple of things done until people get tired of hearing from you.
Yeah.
And for me, relationships have been key in being able to be successful for that many years. Because I can still to this day call to my former institutions and say, we had a really good build and we had a really good solve. Can you show me what that looks like? And they'll walk you through it still.
Yep.
So that old statement of don't burn bridges, it's critical. It's highly critical in being successful in healthcare for the long term.
Yeah, absolutely. Alyssia, this has been a great conversation. I know we're almost at time here. Is there anything else that you're working on or that you're excited about? Kind of final closing thoughts with the community.
Yeah, no, I think we're in the most exciting time in healthcare, specifically in oncology, just treatment options, what we're able to do, liquid biopsies now, really keen into precision medicine, gene therapy, all of the things. And then you layer on the technology piece, having AI to assist you with just your day-to-day in a way that saves time, so you can intentionally round more with patients and your teams and take care of people. I think it's exciting. It used to be cumbersome, right? But now they're coming out with solutions that really let you go back to focusing on patient care. And I think that's why we're all here. But sometimes the work gets in the way and gets frustrating. And I think all of these new solutions are allowing us to go back to that. And for me, I think it's the most exciting time. And I'll keep saying it. I'm excited about what's coming next in medicine, let alone the technology to support it.
That's awesome. It's a great time to be in healthcare. I share that passion and that excitement. And I thank you so much for coming on the show today, Alyssia. This was a great conversation. And again, thank you so much for taking the time.
Had a pleasure. Absolutely. It was fun. Thank you.
And thank you also to our listeners. If you've enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's our show for today. And until next time, I'm Chris Civit-Therese, wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer, podcast music by Nicholas Bach.
Modern healthcare runs on data, but what do you do when your core systems go down? Introducing iMed Health from Taylor Healthcare. Digital tools that minimize risk with proactive solutions for downtime events. Go to imedhealth.com to learn more. Find the link in the show notes.